unhealthy sleep equals an unhealthy heart. A 2011 study found that short sleep was associated with more than 45% risk of coronary heart disease 7 to 20 years after the study. A Japanese study found that sleeping less than 6 hours was associated with 3 times greater risk of heart attack and stroke. Just 1 hour of modest sleep deprivation increases the heart rate and systolic blood pressure. A study at the Chicago University reported that previously healthy individuals who sleep 6 hours or less were 2 to 300%, 2 to 3 times more likely to suffer coronary artery calcification. So again, one of the key things that we want to do with this channel is help people go back to the root causes of heart attack and stroke. And yes, most of the medical community is going to be focused on cholesterol. We're going to focus a lot more on hidden insulin resistance. And one of the major drivers for hidden insulin resistance is this lack of restorative sleep. Now, what has restorative sleep got to do with all this? Well, the sympathetic nervous system plays a key role. You remember the sympathetic nervous system is adrenaline. It's fight or flight. And guess what else? It's cortisol. You remember cortisol? There's a thing called dawn effect, where again, we get an increase in cortisol. We get an increase in blood sugar. It happens usually 3 to 5 a.m. in the morning. And to think of it in terms of function, you think, well, it's getting us ready to hunt, ready to go into our challenging day. And that's okay. But again, with inadequate sleep, we start running too much on cortisol. And that maybe helps you start to connect the dots, where you'll hear us say time and time again, inadequate sleep leads to heart attack and stroke. And there's an issue with insulin resistance in there. Yes, inadequate sleep leads to insulin resistance. If you test patients in a sleep lab and they have inadequate sleep, they will have more insulin resistance for the next 48 hours after having inadequate sleep. So guess what happens after you have inadequate sleep day after day, week after week, month after month? Year after year, decade after decade. You never calm down that sympathetic nervous system. You never slow down that cortisol. Again, it's living on fight or flight. With insufficient sleep, the body remains in some degree of fight or flight state. An overactive sympathetic nervous system has increased levels of the stress hormone cortisol. Sleep deprivation triggers the domino effect. With lack of sleep, there's less growth hormone, increasing the risk of damage to the endothelium, the lining of the artery walls.